episode of Africa Health Check.
The weight of the COVID, more attention I think it has been put on the COVID, and it has seemed as if these other diseases have been neglected in a way.
We look into the infectious diseases plaguing the continent.
We can do what we are envisioning to do. We want Africa without diseases.
And discuss the societal and economic disruptions that they cause. And welcome to Africa Health Check, where we reflect on the health status of Africa. I am your host, Hochontle Paladin. On today's episode, we will be discussing infectious diseases currently plaguing the continent, as well as the societal and economic disruptions that they cause. To help me unpack this, our special guest for today is Professor Francine Ntomi, the founder and executive director of the Congolese Foundation for Medical Research, a professor of molecular epidemiology of infectious diseases, and research group leader at the Institute of Tropical Medicine in Germany. I'd also like to welcome our usual commentators, Dr. Mary-Ann Moreithi, who's the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Before we hear from these experts, let us have a look at this week's feature.
My name is Alois Urasa, born from Rombo district of Kilimanjaro region and currently based in Moshi of Kilimanjaro region, the same, in Tanzania. Like any other graduate from high school in Tanzania, I applied for medicine, and which I was very passionate about, and I got successfully selected to health laboratory sciences. During the COVID-19 pandemic, we witnessed even how fragile our health systems are. We saw how hardly COVID-19 hit the health systems, but also community health was seriously affected. Now, with a reflection on how we have been fighting other diseases like malaria, HIV, and TB, Africa is capable of fighting many diseases only if we stay strongly into solidarity and support these actions, such as youth movements like the Malaria Youth Armies, but also many other movements from the CSOs and NGOs that are doing their best to come to fight diseases, and particularly infectious diseases and non-communicable diseases in Africa. The African continent has so many diseases fighting currently, and we call them diseases of poverty and many others. But to mention the top 5, we have the malaria, we have HIV/AIDS, we have tuberculosis, we have COVID-19 pandemic, and there is neglected tropical diseases. We have seen young people coming up with innovative ways, so we need to strengthen innovations and ideas of young people in the fight against diseases like malaria, HIV, TB, COVID-19, neglected tropical diseases, because these young people composes of the largest population in Africa, and they have so many thoughts, and they know from the pain that they have today and for the future. So we need to do better into engaging young people. But again, we need to do better into science and development and research as well, because we have learned from other diseases like polio that vaccines are the best interventions. The first youth army was launched in Kenya in the year 2021 July by His Excellency Uhuru Kenyatta, who is the current chair of ALMA. And now we are moving into more countries such as Zambia, Eswatini, Mozambique, and many other countries, including Tanzania. And we have recruited champions from 38 countries, a total of 3,000 and more. Youth champions will be forming these malaria youth armies. So the objectives of these armies is to champion for malaria elimination as young people in the countries, so as to harness that demographic dividend to end malaria and improve health outcomes in Africa. My final words is we can do what we are envisioning to do. We want Africa without diseases. We want a prosperous Africa. And all we need is solidarity. And I'm stressing on solidarity because I know it's the key to achieving what we really want for Africa and for the world at large.
Professor Francine, thank you so much for joining us today. I'd just like to take this moment to welcome you to Africa Health Check. Let me take this moment to just kindly ask you to introduce yourself. Tell us who you are, where you're from, and your background.
I'm from Congo, Brazzaville, and my background, I've done my PhD in France and then postdoc at Pasteur Institute, and in Tanzania, I was a leader of the multilateral initiatives on malaria, and I've worked more than 20 years on malaria. And back to Congo, I have established the Congolese Foundation for Medical Research with some colleagues, and we are conducting research activities. But I am also highly engaged in the promotion of female scientists on the continent. That's important, in my agenda.
Absolutely lovely stuff, Professor. Today, we want to talk about communicable diseases in Africa. And before we just dive into that, maybe just briefly lay a foundation for us by, defining for somebody who might not be aware what we're talking about when we say communicable diseases.
When we talk about communicable disease, it's a disease that is transmitted by a vector, as an example, or so like malaria, which is a parasitic disease, like chikungunya, which is an infection transmitted by a mosquito as well. You have Ebola, which the reservoir could be the bat. So it's a disease transmitted through another animal or agent. Let's put that way.
Yes, that's a perfect definition. And what would you say have been the most prevalent communicable diseases in Africa broadly?
We have, as communicable disease, we have HIV, AIDS, which also disease communicate from one infected individual to another one. So the most killer, we have HIV/AIDS, of course, we have malaria, we have tuberculosis as well, which also transmitted, with the droplet in the atmosphere when someone infected can transmit this bacteria to another person. So all these different diseases, as you see, it could be through an animal, it could be through droplets like a COVID as well. So all these type of disease are communicable diseases.
Absolutely agree with you. I think also when you look at malaria, TB, and HIV and AIDS, as you say, that's also where we've seen majority of a population of countries being affected in Africa, and also where the biggest resources in terms of campaigns, intervention, commodities has gone towards responding to these communicable diseases. And just from your experience, as also influenced by research, what are the major drivers or causes of communicable disease prevalence in Africa?
I would say the most important driver would be poverty. Because, when all these diseases are transmitted, because for malaria, we have not been able to really have clear environment. We do not contribute to improve our hygiene, and so sanitation, with HIV/AIDS, we see that in the northern countries, the prevalence, the incidence of the disease has been drastically reduced. And in our continent, we still have a high burden of this disease because we when I say we, it's the government and the community all together. We do not have enough effort in prevention methods, in treatment. So for malaria, I have worked during for the past 20 years on malaria, but there were malaria in Miami, in Italy, and in many countries, and without any vaccine, they have eradicated the disease. So this means that it's possible to eradicate this disease, but it should be a common effort. So poverty is one issue. We need to, and poverty, and we need to have more scientists working on these different infectious diseases, capacity building, infrastructure, and having community engagement as well. So it's really a common effort. We want to fight all these communicable diseases.
Absolutely true. It should be collaborative efforts among all the stakeholders in the community engaged. I'm going to now rope in Reverend Achampong, from your experience as a community leader, but also your medical background. What would you say are the major drivers of communicable diseases prevalence in Africa?
I do believe also that poor education, is to blame. Not many people take these things very seriously. Sanitation, hygiene, if, like the Bible says, teach the child the way he should go, and when he grows up, he will not depart from it. I believe that educational systems must have a design where some of these things are channeled through from the primary schools going on. So people grow being sensitive about hygiene and sanitation. And then also, I do believe that the people have an attitude that everything is spiritual, everything is spiritual, everything is spiritual. So we leave some of these things and we don't really care about them. But spiritually, from my background as a Christian, they say that cleanliness is not next to godliness. In other words, personal hygiene and spirituality are intertwined. So to really be biblical or to be very religious, I think some of these things will be drummed into our consciousness, that personal hygiene, good sanitation, and keeping oneself responsible as a good citizen all play part, but unfortunately, they are not. And that is the problem. That is part of the problem.
Cleanliness is close to holiness. That's the first time I hear that really powerful statement. And I think what you're saying is very true. I mean, I come from Botswana, and it was one of the countries that was hardest hit by HIV and AIDS. And one of the reasons is because at the very beginning of the HIV and AIDS being discovered and the prevalence increasing, a lot of people were taking a more religious or moralistic view and intervention as opposed to taking up the medication and in changing your lifestyle in order to prolong your livelihoods. And I think that's probably something that happened in other countries as well. Dr. Marianne, from your experience as a medical from your experience as a medical professional as well as researcher, what would you say have been the major drivers of the spread of communicable diseases in Africa?
Yes, that's a good question, and it's something we've been trying to unpack, I think, throughout our research history. And it's fantastic to have Prof. Francine here. And actually, one of the items I'd like to discuss with her is what she thinks of the malaria vaccine. But this, besides that point, is one of the drivers I would agree also with Reverend, is that lack of knowledge. And you can remember when we were first hit by COVID, we had to really educate the mass on how to wash their hands. That's when you realize people actually don't know how to wash their hands, wearing of masks, how these diseases spread. Are you boiling your water? How do you prepare your food? No, very basic things, but key. One of the biggest killers of children and babies is rotavirus again. And if we got the knowledge of how to make sure that we are eating good food or clean food, the water we use again is clean, and all those things, we can be able to reduce the infections. But nevertheless, it's not all doom and gloom. We have one of the greatest weapons against these communicable diseases, and I'm sure it's something you want to discuss, and that's vaccines. And I would say, actually, in the last few months, there was a very big drive on all over social media and also in the science world celebrating breakthroughs in vaccines, in particular the streptococci and the Hib, the pneumococci vaccine, and the Hib, Haemophilus influenza vaccine. These diseases or this bacterium cause respiratory infections in children, and it was one of the biggest killers of our children under 5. And once these vaccines were introduced, I want to say 10 years ago or so, we have seen a drastic reduction of the death rates of our young children and babies. So really, it's a fantastic news, and that's why I'm excited to hear about malaria from Prof. I would like to hear what are the latest discoveries, because I think one of the biggest tools we can have against malaria is a malaria vaccine given to mothers, babies, and children all over our continent. So again, it's just education. We need to know what we are fighting. We need to have teams out there in the ground, researchers doing surveillance, epidemiologists trying to model the numbers, how is the disease going to be, the patterns, and that way we can be able to start saying we are somehow eradicating this infectious or communicable diseases from our continent and also the world.
Thank you very much for that. We are going to go for a break. When we come back, I want us to discuss the effectiveness of the campaigns and drives that we have had for addressing communicable diseases in Africa, as well as the gaps, what is still missing and what can still be done in terms of responding to these infectious diseases. But for now, it's time for us to hear what people on the street had to say.
There is something that hit hard to the Ugandans that directed their minds just direct to COVID. So right now, when someone is suffering from HIV, is suffering from cholera, someone will not feel like that is a big deal.
We always prefer trending to attack the trending things. That's the way I see it. So I don't know if tomorrow they will think about the malaria, the cholera again, because right now what is trending is COVID-19, and I believe maybe because the international community is awarding or giving money to that regard, that's why the attention will continue to be on COVID-19.
There is cholera. They still pay attention to cholera and HIV patients because the age for HIV, they're still youth, so they tell us more on how prevention is. They educate us. In cholera, they come and clean our towns, our sewers, and they give us the vaccines on them.
Welcome back to Africa Health Check. We are discussing infectious diseases that are plaguing Africa at the moment, as well as the societal and economic disruptions that they cause. And we have sort of laid the foundation and given a situational analysis on communicable diseases in Africa. And I want to go back to you, Professor Francine. Maybe briefly share with us what have been some of the most effective strategies in responding to communicable diseases, and what have been the biggest gaps in addressing communicable diseases, as I believe that when it comes to many of these like HIV and AIDS, TB, malaria, we are still not out of the woods in Africa.
Oh, the progress, I would say, like mentioned by Dr. Mary, rotavirus vaccines, for instance, has been a success in reducing the mortality in under 5 years children. So, which yellow fever vaccines also has an impact in the population. So all these vaccines have really reduced the burden of the disease and outbreaks in our continent. With yellow fever, there is still some outbreaks in Central Africa, as an example. So this means that the health systems are not well enough organized to really detect and treat the infected people. So that's something, and with COVID-19, we have seen that it has put the light on this weakness of our health systems. So that's one point. But when I talk about the health system, we talk about infrastructure and people, education, trained, have health workers well-trained, qualified. So again, our governments have to invest in human beings, in human resources. That's the first, to invest in human resources. We do not have enough qualified people to respond to our infectious disease burden. So that's very important. And as it has been said, also, we do not engage enough the community education to explain. I come back to malaria. Malaria, for many people in Africa, it's, a simple disease. Because you born with malaria, you die with you think that it's your friend, more or less your companion, your life companion. But it's possible to break the cycle, the development cycle of this parasite and so on. So education also, to have the community to understand and accompany the control measures established by the stakeholders. So not to be long, I would say that the gaps are there: human resources and investment. Unfortunately, funds are the nerve of the war, and we cannot fight our infectious diseases by only waiting for resources from the north. That's not possible. That's not possible. We need to increase our domestic investment. But unfortunately, at the moment, we are still waiting for, alliance coming from the north for tackling our major challenges. So when we will change our way to our paradigm, I'm sure we will be able ourselves to all together to really respond properly to these infectious diseases, because some of them are only prevalent in Africa, some of them. So we need to so that it should be our first priority in our agenda, but it is not. It is not.
I absolutely agree with you, Professor Francine. I think we can all agree, if we're being honest, that for many of our countries in Africa, there's sort of some bit of dependency from external sources, donors, to finance our response to communicable diseases and even strengthen the healthcare system so much that even if we can mobilize resources locally, domestically, we are still reliant on donor funding and can actually say, okay, we don't have finance to support this malaria program because this year the donor didn't give us the money. So that is really, really problematic, and that really is a matter of political will and commitment. We've talked about the importance of community or public education. We've talked about poverty reduction, responding to communicable diseases, the need for political will and commitment, as well as mobilizing resources. So I want your final word to be a call to action to any stakeholder who's listening to this program right now about communicable diseases and the prevalence in Africa. I want you to just give them a message, a call to action to get them to get up, to start playing that role, irrespective irrespective of where they may be placed in this collaborative efforts, but just a call to action.
Thank you very much. To jump to what the Reverend said, we should have in mind that the high burden of infectious diseases is directly linked to our poverty. Africa is not poor. We are rich of young people, rich with many oil, etc. But we lose our forces with these infectious diseases because we lose our families, etc. So really, infectious disease burden is linked to economy of our countries. So if we solve one, we will solve or we will improve the economy. So that's important. So the stakeholders have to take that into consideration. First, second, there are today many very good African scientists in Kenya, in South Africa, in East, West, Central. Today, and scientists, as mentioned also, under the leadership of Africa CDC, WHO, Afro, the networks are stronger. So now we need to continue in that way and really to be proud of our result. We need to be able to really, that would be my word, to ask our stakeholders to rely on their people, not only waiting for the solution from outside, to rely on their own people. And they can be sure that these people will produce the right solution, but they have to invest in human, and that's the key point, invest in African human beings.
Wow, such a powerful ending. Invest in the human being, in the African. And I think it's even more powerful for us because, this month of June, we obviously observe June 16, which is the Day of the African Child, and when we give rise to the value of an African, and especially young people, since Africa is a youthful continent. And I think all of you have really added value to this conversation. The major thing that I'm getting out of this is that, we really need to do more to address poverty in Africa, because poverty is not just about not being self-sufficient, but it affects all other aspects of our lives and even undermines other areas of health, education, dignity, well-being, and even the progress that we are making as a country. We are regressing because of poverty. But once we address poverty in Africa, then we won't have a lot of the challenges that we face as a result of poverty. So thank you so much, Professor Francine, Dr. Marianne, as well as Reverend Anthony Achampong, for sharing your very enriching and thought-provoking sentiments as usual. We have come to the end of the show. Do remember to connect with us on the social media platforms. We would love to hear from you, your story, what you're doing to improve the health outcomes in your respective country in Africa. So do check out Africa Health Check. Until we meet again, same time, same place, same day. Remember that the future is Africa, the future is today.